pentuma papa efra so bra na wo dran na wo chiro ho dia na onuane Susie stuffing ana oye wait oh that's it akama ebia mawo
ma nimbisa wa sam kakra irisi wodan fofra odawa komanda no Kingsworld Furniture inyi haubiara Kingsworld Furniture yedensi nibiara na last stop tiles plastic non wooden ceilings burglar proof aluminium doors aluminium windows kitchen cabinets abua papa non tokra nyinara ebinye bi wo Kingsworld Furniture say asem do ye say pede yesi wodan ni yesiesim ye furniture fittings na zinhinara zemaoza Fred 02491911139 and also 02081800041. Say ewo Amsterdam no Frekin and Mr. Arthur was 0031-685-808388 and also share your website www.kingsworldfurniture.com. Ibohu Kingsworld Furniture wa Putweja Lake Road. Kingsworld Furniture, perfect finishing.
Ladies and gentlemen, thank you very much for the opportunity to talk to you today. My name is Professor Charles Ajman. I work at Amsterdam Medical Center, University of Amsterdam. Today I'm going to talk to you about coronavirus. I know you've heard a lot about coronavirus for the last few weeks, if not months. But please bear with me for the next couple of minutes because coronavirus is certainly having a huge impact in all walks of life. People from all walks of life, including kings, prime ministers, rich, poor, adults, and children, have all been affected by the virus in one way or the other. As I speak, nearly or more than 8.5 million people have contracted the virus, and more than 500,000 people have lost their lives to the dreadful virus, according to the World Health Organization. We are seeing similar problems also in the Netherlands, where all people from all walks of life have always been affected by the virus. Unfortunately, we still don't have a vaccine, and that means that we need to do our best to protect ourselves and our families. It is equally very important that we get to know more to help us to keep safe. And that's why I want to talk to you today about the virus. Although we know that the virus affects everyone else, but what we've learned is that it appears that some people seem to be protected by the virus. And when they are actually attacked by the virus, they don't show any symptoms and they walk free. Whereas others, when they are attacked, they become very, very ill. They end up in intensive care, and some die very rapidly. So the question this raises is why is it that some people are so strong and able to withstand the coronavirus, whereas others don't? And what can we learn from these people in order to protect the whole society? So with these very important questions, the Dutch government contacted the Helios study team to try to help to find answers to some of these important questions that the virus is imposing in our society today. The government selected the Helios study because the Helios study covers the major ethnic groups in the Netherlands, including the Dutch, the Surinamese, including African and the South Asian Surinamese, Turkish, Moroccans, and the Ghanaian population. So clearly, this offers a very, very important opportunity to include all the ethnic groups in order to understand how the disease spread and what we can do in order to protect ourselves and our families. So in the coming weeks, you will hear from the Helios study team. And we will select those people that took part in the Helios study to complete a small questionnaire and also to provide a very small blood sample in order to help us to be able to answer some of these major questions that the virus is imposing in our society today. Unfortunately, those people that did not take part in the Helios study are not eligible for this study. I know that many people are saying, why not? You are doing this because the Helios studies already do have the baseline, which will allow us to be able to get more insight into the causes of the deadly virus. That's why we are only including the Helios study participants. So please bear with us if you are not included in this study. So those that have already been to the Helios Center for Measurement this year or last year are eligible and may be asked again to take part in this study. Those people that are about to come for measurement are also eligible and may be asked to take part in this study as well. I want to emphasize that those that are ill with the coronavirus or are showing symptoms are not eligible for this study, and they need to contact their GP as soon as possible if you have symptoms, please, or so those people that will be selected to take part in this study will receive a letter and a phone call to come to the Helios Study Center, which is next to AMSA. I want to reassure you that the Helios Study location is absolutely safe, and there is no cause for concern for coming to the location for measurement. Strict hygiene and social distancing rules are in place. And I also want to take this opportunity actually to emphasize that AMSA in general is absolutely safe. So if you need help, if you are ill and you need to come to the hospital for checkups and everything, please, please, please feel free to do so. Because the last thing you want is you coming to the hospital when you are absolutely ill. There is no need for that. The hospital is safe. What I want to say is that we need to fight the coronavirus together to protect our communities. After all, our health is our wealth. That is why it's so important that all communities in the Netherlands need to take part in this study to stop the virus. Together, you can fight the virus and win. So you can always contact us for questions if you do have some. Our televised program on the coronavirus is actually freely available. So you can always contact us if you need more information. For more information, please call 020-566-3792. I repeat, 020-566-3792. Or email us at info@heliosstudy.nl, or visit the Helios Study website, which is www.heliosstudy.nl. Thank you so much for the opportunity to talk to you today. If you work together, I'm pretty sure that we can actually fight the virus and win. So I wish you well. Please stay safe and well. Thank you.
Adolfo Amohwe me Samri, a Veronica van der Kamp, Helios Study Ambassador. And Shishemu Abase, coronavirus, ya ebaye. Ababetu ye. Etumi ebinom pa. Si obi wo hokra na symptoms kra no onya ya no wa recover. Obi so wo ho a eka na age intensive care nyame ambem a na wa hwere ne nkwa. We ni kyerɛkyerɛmu a doctor edebre yen enwumre a na o kyerɛkyerɛmu. The question abeda ho ne say adenti na corona etumi ebinom na ebinom so do ntumi survival. We a big question. Abai ehwe mu ano on say Helios na yebetumi aye sa research inti no etise yehu akuse de be ya yare we yebetu nase yehu yare yenya eso bibia ye de besa yare na ese yetumi hwehwehwe nemem na ehu ekwan a ye de beso ano ma ye nyina ye ho ebeto yen onu nti Helios fo ya fa to ye ho so inti no obia Helios efrewo last year ni this year nso ye be sign ascend letter na ya sign ahwehwe aye research kakra edi ehun say ye benya answer to this question. Uba just a blood sample kakra bi keke in Helios ebe na omode aye understood kuni ahwe wapomudie ebe ye bi hu so apomudie we etisa apomudie we na etumi dia compare na emebi na ye hu na enti etumi ebinom a entumi ebinom ti no eyemba wankasa nso se ebema nso ye hwa ebe hu nso se de wapomudie ti na beboa nso amayare nso no yasano ti ye the letters ebeba round unsaka acha said the doctor beka ye invite mu bio say mu beba research center honso de very safe measures bia say ye take said the be safe ama 1.5 meters no mni adenya measures nyina ye be take but the best remo so ne say yes so in case say wo yare dia ene na ente say uba na chese the doctor bekan no emunchire mu kakra ena me dia mamu me damase me did the Veronica van de Camp Helios Study Ambassador besi atime nkebio.
Hello, welcome at the Helios research location. My name is Eva van der Linde and I'm a member of the Helios research team. You received an invite to participate in the Helios study. This video is to show you around the Helios research location so that you know what to expect when you visit the location. As mentioned in the invitation letter, please do not come to the research location if you have any symptoms such as coughing, a sore throat or fever. Your Helios appointment will be postponed. Upon arrival, please take off your face mask and disinfect your hands using the hand sanitizer. Hereafter, you can proceed to the reception. Upon report at the reception, you will receive some research documents. In the waiting area, chairs are placed 1.5 meters from each other. A Helios team member will guide you to an examination room. In the examination room, a distance of 1.5 meters will be maintained between the participant and the Helios team member. Of course, this is not possible during the blood sample collection. Therefore, the research assistant will be wearing a face mask during the blood sample collection. After completion of your study visit, a Helios team member will guide you to the exit. I hope this film was informative and you know what to expect when you visit the Helios research location. If you have any questions, please visit the Helios website and do not hesitate to contact the secretary for further information. Thank you for watching this film. I hope to meet you at the Helios research location.
To this special episode about what is happening in the world, all about our way of the pandemic we are facing. And there are so many questions people are asking. There are so many misconceptions. There are so many things that are.
What we know is that there's only 2 countries that is actually doing better in terms of the data collection. I would say South Africa and Ghana. These are the countries that are actually doing much to collect the data at the moment. And it also has to do with the issue of the resources available. I mean, to collect data, and this all comes down with resources. And many countries don't have that resources to just do that. But what we know though, from the African continent, particularly if you go back to Ghana and other countries, is that although the condition for in Ghana, for instance, now they've detected about say 5,000 people or so, and I think it's only about 20 people have died. So actually, if you look at in terms of death coming out from the coronavirus, what we see in Europe and what we see in many African countries, so far is lower there. But this is an early stage. We don't know how that is going to turn out. So let's hope that, it continues that way, because if it doesn't, remember that in many African countries, there is always a difficulty because there is no ventilators. I mean, America, the most richest country on earth, is struggling with ventilators. Imagine what is happening in a country such as Ghana, Nigeria, and others that are not as so rich as this country. So let's hope that.
This brings an interesting question I always ask myself. Now, we always talk about peak of the issue. How do you determine the peak? Because it goes up and comes down. How do you determine it?
I can speak for the Netherlands. What we saw is that the outbreak started in the south of the country. Probably it was driven by two major things. People having carnival, where you're going out late at night, people are singing, they're hugging each other, they're in close quarters, there are a lot of people together in bars, which probably spread the virus in that regional area. And then it was also spread in the Netherlands by people returning from vacation from Italy. That was quite hard to get at the time. And that led to a big surge in infections. And of course, one person is infected and they infect 2 other people, and then that goes to 4 and 8 and 16, and that grows. And then the government started shutting things down, making sure that people had distance, and those efforts have really dropped the number of cases in the Netherlands. I can tell you in the hospital, I'm so relieved. We had 3 floors with 3 departments full of COVID patients. Now we have half a department. And the number of patients who are in the ICU have gone down dramatically. So our peak has gone down, but that doesn't mean that we can't get another peak. And so as people start to resume their normal lives, maybe it's harder for them to stay at a distance, people start to come together, probably there will be new waves of the infection, but how big those are and how many people will be affected, we don't know. But we do know that if we implement social distancing, that it can protect us because it can drop cases.
Interesting. Is there any medicine or vaccine at this time?
I really wish that there was. I really, really wish that there was. But right now, one of the hardest things in being a doctor, I have to say, is not being able to offer medicine to patients who are infected. And there are a lot of different medicines that are being tested. There are a lot of different medicines that people think work or think they should work, and politicians who think that medicine should work. But actually, as a physician, I only want to give a drug to a patient if it's been proven that it really protects them and doesn't hurt them. And right now, we don't have those medicines. At the same time, there are lots of companies and universities that are working on developing a vaccine. The vaccine is different from medicine because you give it and then you'll be protected from the disease. And that development is going really fast, much faster than vaccines for other diseases, for example, against Ebola. But that'll take definitely time. Vaccines are hard to make. That takes about a year.
One of the questions people ask in our community is, why is it that government doesn't allow people or make it a law that everybody should wear a mask?
It's a good question. And every country seems to be doing it differently. So I think that because this disease is only 5 months old, we know so little about it. And we also don't know the best ways to protect society. Masks, when I see a patient and I take care of someone who I know has corona, I wear glasses and a mask and a gown, and when I go onto the unit, I get dressed, and when I go out, I get undressed very carefully. I wash my hands like 20 times. But if I'm walking around outside and I'm feeling fine and my neighbor is feeling fine, is it appropriate to wear a mask? And some people, when they wear a mask, what they do is they put it on and then they wear it the whole day. And maybe you infected me and I got some of his droplets on my mask. And I've been wearing the mask for hours and I forget about it. And I take my hand and I go like this and I go like this. And then I pull the mask over my nose And then the mask kind of pushes the droplets into my nose. So wearing a mask for long periods of time gives you a false sense of safety. Probably the best thing that a mask does is that if I'm sick and I'm wearing a mask, it's less likely that I'll infect someone else. So that's why, for example, the government has asked that people wear masks in public transport, because there are a lot of people in small spaces, and you want to keep people who are infected from spreading it. They don't do it so much to have people be protected. It's really to keep from spreading.
And also people need to remember that you have to put the mask on correctly. That's also another thing, because I see a lot of people wear a mask but they put it under their nose, then they're like, it's not that effective.
Yeah.
And also they're wearing the whole day, they're putting it on, they're off, they're touching it. So at the end of the day, the way it's supposed to protect is not even protecting anymore, because at the end of the day, you're more spreading it out if you're...
How do you put it on perfectly?
You have a sample for us to demonstrate?
A mask should fit, a mask should fit around your nose so that this is as close to your skin as possible, and that it covers this part of your face, because you don't want it to get into your nose and your mouth. And when you take it off on both sides, and you take it off this way so that you don't let the outside touch yourself. And when you take the mask off, you wash your hands. But the most important thing when you have a mask is not to touch your face. And the most important thing you can do to protect yourself is maybe not wear a mask, but just wash your hands a lot.
And if you know you're sick, stay at home.
And if you're sick,
that's
don't
the
go
most
outside.
important thing. Is if you know you're sick or you're not feeling well, or you suspect it or anything, call your GP to discuss it. They'll give you the advice. And also, if you're in doubt or anything, stay home. Because at the end of the day, if you're infected and you go out and you don't use the correct procedures, at the end of the day, you might be infecting other people.
Okay, if you are sick, stay home. There's another misconception also that when you go to the hospital and even you don't have COVID, they presume you have it, and then they will just put you add you to the COVID patients. How true is that?
No, I remember that the hospitals are there to save people. In the hospital, those people that are working there are highly experienced people. And I keep on saying that to those of us that travel many parts of the world, places like Amse, Addis Ababa, one of the best hospitals in the world. I keep on giving us an example. Even the richer countries such as Saudi Arabia and others, when a very important person is sick, they ask them to go to this type of hospital because they know that they have the specialties here. So the fact of the matter is the people are there to support people. So if people are ill or sick and they need to go to hospital, it is very, very important that people go because there is a system in place. Even as Dr. Vanessa mentioned, even the COVID part, you've created a specific ward specific for that. So it's a completely separate from other part of the hospital. And you all know the RMC is a very, very big place. And so if you are sick and you need help, please don't stay at home and get soaked and then get more complication of your condition. Remember that, for instance, if you have heart condition and you need to see the doctor and you don't, it is going to get more complex. And if you don't take care, you're going to have a very bad outcome out of it. So the hospital is there to serve. The doctors, the nurses, and health assistants, they are all ready to assist people. So please, 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 this misconception is not helping anyone. And therefore, people should start using the hospitals if they need to be. I don't know if...
Please come. Yeah. The worst thing would be that we would have this horrible corona pandemic, and then we would also have people getting sicker because they're not coming to hospital when they need to. And we are doing our best to make sure that we can see the patients that need to be seen and take care of them in the way that they
So I think my advice for everybody that if you're feeling ill, you have any health issues or anything, call your GP. If you're even afraid to go to your GP, you can always call them and they'll discuss with you if it's necessary for you to come in. And I think all the GPs in Holland are prepared. They have certain measures taken, put in place to avoid spread of people getting corona. So if you need the help, we are all begging you, please call your GP, call a health professional to even discuss it. If it's necessary, they'll give you the advice for which step to take. Right? Let the health professionals know what's going on, because as Dr. Vanessa said, it would be very bad if at the end of this epidemic that we have another wave of people with certain sicknesses or disease that could be avoided, or the outcome could have been a bit less.
What about the use of bleach and disinfectant on our body to prevent COVID?
Please don't put bleach on your body. I mean, when you're cleaning your house, you can use bleach, and bleach is very effective. It will kill COVID. But when you put bleach on your skin, it hurts your skin, and it won't keep you from getting the disease. So
don't do it.
Don't do it.
And what about eating certain food? Does it prevent?
I mean, there is misconception, and I think we were discussing it today. I've seen a lot of videos, asking some people if you say that if you eat ginger, if you eat this, and you can.
So
the idea is that actually healthy food is good for everyone. It's good for the immune system and everything. So it's very, very important that you continue to eat very healthily. I mean, that's very, very important. But I think it will be a deception if you think that eating the ginger would, prevent you from getting COVID. That it is not how it works. You prevent COVID by keeping to the rules, making sure that you wash your hands frequently as much as you can. So I don't think that you should deceive ourselves and confuse the message with it. And ensure that you eat very healthy as you've been doing even before the COVID. That is actually what is the Health is Your Wealth has always been doing, educating people to eat very healthily. It also means that, I think what I was also mentioning is that not only that, ensuring that if you are on medication, you take them. If you need to do more physical activity, you need to keep yourself healthy. Because if you don't, and you develop chronic conditions, if your chronic condition become more severe, that's where you become a victim to the COVID. That's where your complications, after you've got it, become worse off. So it's very, very important to keep healthy. But don't, deceive yourself that, if you, I've seen one video whereby describing that if you cut, I think it was pineapple leaves, and then you add ginger to it, and then you drink it, and then all of a sudden you become a Superman. And then the COVID cannot touch you. So I think if you do that, you will be deceiving ourselves. It's very, very important that we protect it, and it's very, very important that we stick to the advice that is being provided. More importantly, Dr. Vanessa, who is, in front of you working with this, keep on saying hand washing. Hand washing. We need to exactly keep distance, and ensure that we do these basic rules. And we shouldn't, worry ourselves also there is ginger out there. If you want to use the ginger to cook, perfect. Enjoy it. But don't think about the
question about testing. Because many of our members of the community, they were asking, why can't we test our people and allow them to come to church?
Yeah.
How feasible is that?
Well, right now, there are limitations on how many tests we have to see if we should admit them or not. We're using it for individuals who are having high contact with patients, like healthcare workers. They're going to start testing people who are in professions that require contact with individuals like hairdressers, but particularly teachers, physical therapists. So as more and more testing becomes available, it'll become more and more available for the rest of
Is it so costly to test people? Why can't
Why
they
is
just
it so
test
hard?
everybody?
Because we just don't have the materials.
Ah.
Yeah, so everyone in the world wants to test right now, and the factories, especially like these sticks that we use to test people in their nose, they're very hard to come by. So, and it's also, you need to have enough laboratory capacity. We're not used to testing so many people, so there are many different levels of infrastructure that we need to build out before we can do the testing that we want to. Yeah, and think about ways that we can permit people to come together, because that's what we miss so much. But we want to be able to do it safely. Yeah.
Well, what about undocumented people in Netherlands? Undocumented migrants.
Yeah, I think that's a very, again, a very, very important point. Particularly these people are, if you like, I call it sort of, it seems like they don't exist. And usually they can't even use the system. And more importantly, you know, you're talking about social distancing, you're talking about self-isolation. That means that someone else needs to have resources to be able to look after themselves within this period of part. So certainly this is a very, very tricky part. The good thing though, particularly those in the Netherlands, that everyone is, have the right to access healthcare. The danger is that many of these people are not documented, tend to be afraid because they know that if they go, they might be reported. But what I can say is that, you know, the Dutch GPs and others, they know about it. So if you know you are non-documented and you have symptoms, please just call. And I can assure you that the GPs and others will treat it very confidential. You're not gonna, you know, report you and others. There are systems in place into that. So please, if you are sick, particularly if you have symptoms, that needs to be urgent, you need to see a doctor. Please, please, please call the doctor, and the doctors will be happy to assist you. There are also other avenues, such as Doctors of the World, who are also there to provide further assistance. So there is always a way that you can actually go through to get help. So if you are non-documented and you have this condition and you need help, please do so. Because if you don't, then you are risk. You risk basically yourself. You also risk other people's lives, because then you pass it on, you don't report it, and then it can continue to spread. So for the benefit of those people, and for their own community members, and for the people at large, it is very, very important that these people take responsibility, you know, just be bold, and then call. So if they need help and others, you know, Doctors of the World is also there. I mean, you've given the number before, and they are willing to help them to navigate through the system.
And I think also to add to that, that everything that you discuss with your doctor or your healthcare provider, it stays private. So you don't need to be afraid that if I tell my doctor something, it will get spread through the whole community or anything. Every healthcare provider has that obligation that everything that a patient says to you stays between the two of you. So that people don't need to be afraid that if I go to my GP or if I go to Dr. van der Wereld or any healthcare service, that they'll tell everybody that I have this disease or anything.
We are required by law to protect your privacy. And also the emergency room, we will treat you regardless of your status.
Now, the children are now in school. And the question is, why are they now in school? Are they immune to this disease?
So there's a lot of debate about how susceptible children are and younger people to COVID-19. And to be quite honest, we don't completely know, but we do know that children can get the disease, and if they get the disease, it tends to be less severe than older people. So the older you are, so everyone probably can get the disease, but some people will have a worse disease than others. And children probably will get mild disease, very short disease, which means that compared to someone who's sick for 7 or 8 days, they'll spread it less. So we think that the numbers of children that are infected are lower, that children are less likely to spread the disease than adults, and they're also less likely to get sick than adults.
And why is it so?
We don't know. It's a great question. Yeah, we really don't know, and it's a really important question, because if we could understand why children were less susceptible, we might be able to use that to help others. That's right. Yeah.
So is there any research being done to understand that?
Yeah, there is a lot of research to try and understand why some groups of people seem to get sicker than others, why children don't get as sick, why people who have obesity and heart disease get sicker. So we think everyone can have the infection, but why do some people get sick? We don't know. There's a lot of effort going into understanding that.
How long does it really take for you to recover from COVID-19 here?
So a typical course is that I become exposed to someone who has the virus. I don't know that I've been exposed from anywhere from 2 days to 2 weeks. On average, people start to get symptoms 5 days after they've been exposed. So I was exposed to someone on Monday, and maybe Thursday, Friday, I'll start to feel a little bit ill. And it usually starts as a mild disease. So some typical symptoms that people have are that they lose their sense of smell and their sense of taste. So if you have those symptoms, that probably definitely need to stay inside. Other people can get a runny nose, some sneezing, a little bit of a cough. And for a lot of people, that's all they get. Maybe a little bit of fever, 38 degrees, and then they get better, and it's like they had a flu or a bad cold, and they're better. So maybe like a 25-year-old person would have something like that. Other people, particularly elderly people, people who are overweight or who have bad diabetes, they're at risk for having a different sort of course. So they'll get infected, they get symptoms, they might have some of these things like loss of smell, a cough, and over the course of the next week, they start to get sicker, and they start coughing more, they get higher fevers, they start to get short of breath, and that's the point when they start to call their doctor and say, I'm not getting better. And that slowly develops. It doesn't happen in the beginning. And at that point, we really want to see people in hospital to make sure that their lungs are working well enough, that they're getting enough oxygen. And for the people that come to hospital, the majority, they might get really sick. We give them oxygen. We try and support them as much as we can. We treat all their other diseases. And a lot of people make it through after being sick for maybe 2 weeks, 3 weeks. Other people, they have to go to the intensive care. We have to put them on a breathing machine so that they can have help breathing. A lot of people survive, but we also see a lot of deaths. And for the people that survive, we really don't know what kind of effects the disease has on them in the long term. But they do, it takes a lot of work to fight through the disease if you are that sick. So people are exhausted. They've lost muscle mass. They have a recovery ahead of them.
So what was your experience treating people as a frontliner? What was your experience?
Yeah, it was an experience I don't want to repeat. Yeah, I have to say I did it with, everyone in the hospital worked really hard, a lot of GPs, we had nurses that normally worked for the pediatric wards who came and helped us, so it was, a lot of people came together, so in that way it was a really special experience because everyone was working so hard together, but people are sick, it's hard, you don't have anything in your hands to treat them with, It's hard to get family members to them because we don't want them to infect family members. So people are often quite alone. We do our best to make them feel like we're with them and that they use their telephone and other things to be in contact with other people. But
What's terrible, is what you say.
it's horrible. It's horrible. So please protect yourself.
Is it possible to be infected, go through the whole problem, and develop immunity without knowing?
We don't know. It's possible. It definitely is possible. So we think that probably if you've had the disease, at least for a period, you're protected from getting it again. We don't know that for sure, but we think that. It might be that if you have mild disease, you might be less protected if you have really bad disease, but we just don't know. And some people are infected and they never develop any symptoms. So we really, really hope that once you've been infected, you're protected. And that's what we're sort of thinking, but we haven't been able to prove it yet.
Dr. James, your final response.
Yeah, I think that, you've heard a lot today. It is so important that you keep healthy. I think that I always say that what you keep on saying, our health is your wealth. And that means that we need to take very seriously the message that you've received today. And you need to also heed the advice that is given to us. Hand washing, I just can't stop saying hand washing, because if you don't hear anything from us, hand washing, please. And do it. Exactly, do it very regularly. And if you are very bored, just continue to sing happy birthday whilst you do it. And I think that will be very, very important for everyone. And I think another point I want to make also is that there's a lot of misinformation going around. It is very, very important that you be very vigilant and be very careful, because there are so many things that are going on, and you should not take these messages as a given. There is a clear rules and regulation what to do. Let's stick to those parts. Another thing I would say is that the misconception that the disease doesn't affect the African people or black people. Now we know that it's actually these communities are even dying more compared to what you have anticipated. That means that this community needs extra care. Particularly those people that do have pre-existing conditions, such as heart diseases, diabetes, being obese, and others. We need to take extra care. I can't help also saying that many of these communities, many of us, unfortunately, live in a very small spaces. And that means that the social distancing becomes problematic. This also means that the idea of taking care for yourself becomes even more necessary. So we need, wherever you are, to ensure that you obey the rules and the regulations that are currently ongoing. I also would like to emphasize that those people, particularly those people that have pre-existing conditions, if you are ill and you need to go to hospital, please, the hospitals are safe. The doctors and nurses are there waiting. So please don't, afraid that if you go there, you're going to catch COVID-19 and therefore you're going to stay at home. If you don't, actually COVID-19 will not kill you. Your pre-existing condition is what is going to kill you. So please, 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 if you are ill, go to the hospital.
Yeah, I just want to say thank you to Professor Charles and Dr. Fanesi for taking time to be with us, to be able to share your knowledge with our community. I just want to add one more thing, that because I know we believe in God and we pray. It's good to pray, but it's not enough to limit ourselves to prayer. Let's also take all these measures that has been developed to prevent the spread of disease, because some people just think once they pray they are okay, and those are some of the lies and deceptions that has really kept people in bondage. Prayer is very good. I want to say that again. Prayer gives us wisdom and understanding to be able to know how to protect ourselves. So please pray, but at the same time, let's follow all these regulations that will keep us safety, and not just us, also the people in our cities. Thank you for watching.
Before COVID-19, I think we've been saying it for years, all the healthcare professionals have been saying it. Watch your lifestyle, live a healthy lifestyle, eat healthy, exercise. In this situation that we're in, you can go outside as much as you want, but through YouTube, social media, there are a lot of ways to exercise by videos and online workouts. So even though we are inside, we can always exercise. So my number 2 points are healthy lifestyle, and if you need help, please, 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 please seek professional help.
And I hope that you've been informed to take care of yourself. Thank you so much for being part of today's program, and we know that very soon we'll get you back as things develop so that we can have some updates. Bye-bye for now.
Anapa ne isim so adasa nyameda de mekudu akwa
Zagadat.
nyameda de mekudu akwa
sister, I know be your brider. Give me one chance, make I be a fighter, provider. Toto for my man, make I be a pasta. We need you team, make I be a sponsor.
Oyoko abusia panyin a wɔkyerɛ patre awayi ne mpaboa hyɛ abusia panin barima owusu yeboa sana hene Holland barima kwaku dadeɛ nana kwadwo nyantachi otumfoɔ sana hene nana agyeman kromo asante hima chiame nana sewa po asante hima chiame nana aboagyewa kokɔ homo hima ɛne oyoko abusia anamu ɛbɔ wonka yɛsɛ afei na bra so sɛ wɔyɛ nana owusu ano panin a wɔtɔsoɔ miɛnsa kyerɛ patre hene a wɔkɔ akura yɛyɛ ne na ase asɔre ɛwɔ Amsterdam yɛn nanai ne ma a yɛnim wɔn ɛwɔ Holland ɛne onomonyamfoɔ Kofi Owusu dadeɛ nana ano adwoa kunadu dadeɛ anipa dodoɔ enim ne sɛ adwoa da Costa Gamtv adwoa jamfua dadeɛ ɛne afua acha ɔfaseɛfoɔ a yɛnim wɔn ɛne akwasifi anipa dodoɔ enim ne sɛ amanfoɔ akwasi Recording Radio Amsterdam onomonyamfoɔ kwabra apia anipa dodoɔ enim ne sɛ Gambra Den Hague asew a yɛnim no fa na ase asɔre ho ɛne yɛn nuaba Florence Prince Acha abusuan hyehyɛ ne sɛ yɛbɛyɛ yɛn nanan na ase asɔre August bosome no da ɛtɔso aduonu mmiɛnsa ɛda yi ɛyɛ kwasieda ɛwɔ Roman Catholic asɔre a ɛwɔ Holendrecht address ne yɛ Millenhof number 158 ɛna postcode ɛyɛ 1106 TT efiri anɔpa non-dubrem kɔpem sɛ awia dumienu ɛbɛbɔ yɛfiri na ase asɔre no so a yɛn nyinaa de yɛni ɛbɛkyerɛ Kingston Park no so yɛ de reception akotoa so wɔ bere a abɔ awia nomienu brem ɛkɔpem sɛ anadwo nɔnkron ɛbɛbɔ ɔsi yɛ ba a yɛnhyɛ black and white ekuo ahodoɔ ɛboa ma na ase asɔre abasoɔ ɛne All Saint Catholic Church, St. Teresa's, Blessed Trinity, Men Fellowship, Ghana Union, Blessed Trinity, Gamtv, Lake Road, all friends are the best. Trepatrefo, Mama Gata Adepamfo, Kingstonfo, Oyokofo, Nananom our Tinkonyo Tuntun so our Ghana, Nananom our Diwonkonya our Holland, and Namfo, Sorry, Asofo, any Ankrankre, or so two on Safre answer the man na say, Yamata wachi M1, Amwanya 1 and 9 now, sorry, our Amsterdam, Enyane Kwankrakra, was it Bribi Achi Wadrian Fre, 0641 488 933, Abusuan Adayana say.
Ma members wa asam kakra irisi wo dan fofra odawa komanda no Kingsworld Furniture inyi haubiara Kingsworld Furniture yedensi nibiara na last stop tiles plastic non wooden ceilings burglar proof aluminium doors aluminium windows kitchen cabinets abua papa nonyin tokra nyinara ebinye bi wo Kingsworld Furniture say asem dawiye say pede yesi wodan ni yesiesim ye furniture fittings na azinhinara zemaoza Fred 02491911139 and also 02081800041 say ewo Amsterdam no Fred Ken and Mr. Arthur was 00316885808388 and also share your website www.kingsworldfurniture.com. Ibohu Kingsworld Furniture wa Putweja Lake Road. Kingsworld Furniture, perfect finishing.
To my papa, Efra, so na would drown na would show dear, na or no one Susie stuffing. Susie stuffing and na oh yeah, wait. Oh, that's it. Mama Susie, when you're at the a free school. Miniano, who are Obecasa a duku, but a yentoma. Said you hear, yes, see, I will born no. Yabu born a camera, and here could I say, Obata dear Nadia Shemu, dear would dear Hiana say, Obata pass and now the Akata who know what it is. A woman different colors, and one as I would do for be. Our person would try, dear coach, would do for you very important, Mauno. Bra, never jibby, never come out. Like I said, anybody didn't know about that was so. I knew I found out. True me can I budget with you. My Jimmy dear, and to so bra, never do with you.
And we are near Dofo. Some at the papato. A can't percent just open to my papato. And I lace papato. And a material lining a dear zip papato. Susie stuffing or Amsterdam spot. Shopper horn, Uko Habinia. Your people are being share. We are so lazy. Share. So, 1 year do, say 2 years so, not a papa blast. Susie see Obechepiama. Open when up at the body. And you know, home Susie stuffing. Now, remember that Umanyama Kwaswadi. So,
I open to my papa, Efra, so na would drown, na would show dear, na or no one Susie stuffing. Susie stuffing and na, oh yeah, wait. Oh, that's it.
I was diagnosed with HIV 5 years ago. It was my nightmare becoming reality. couldn't believe it, and I didn't want anyone to know about it. The only person I could talk to about was my doctor. My doctor helped me with understanding my condition better. I've come to learn that HIV is not a death sentence. I also learned that when I take my treatment every day, I can live a healthy life. I can no longer infect anyone else with HIV. I know now that my condition is not a threat to anyone else. That's why I feel free to share my HIV status. I told my sister about it, and she accepts it without fear. U equals U means undetectable equals uninfectious. I have HIV, but I cannot pass it on to you when I take my medicine. Don't fear me. I'm healthy. 'Cause you